Hey, what's up, guys? This is Dr. Enoch Kotei, the primary care physician you can trust, breaking down the topics you care about in a way that you can understand. Now, have you been diagnosed with high blood pressure or hypertension before in the past? Or are you interested in learning how to avoid it or prevent it? If so, stay tuned because I'm going to talk about the lucky number 7 ways to beat hypertension without medication.
We in it. We in it together. Like clockwork, we admit for withdrawal. Patients with the shakes cause their bodies feel for alcohol.
Now, before I get into this video, I should mention that for some people, there's absolutely no way around taking blood pressure medications. And this all depends on how severe your blood pressure is, or exactly how long you've had high blood pressure for, and whether or not you've tried lifestyle modification already. But for some people, it's important to make sure you start blood pressure medications as soon as possible or right away, or stay on them, because if you don't, then you could be at risk for a lot of acute diseases, whether it be heart attacks, strokes, or even kidney disease. So if your doctor has recommended that you take blood pressure medications, it is important to be compliant with that because there's probably a very good reason why they would like you to be on them. Now, I know you've heard it before, but I'm going to mention it again and again. Diet is the most important way to beat hypertension, especially eliminating the salt from the diet. I prescribe for my patients the DASH diet, also known as the Dietary approaches to stopping hypertension. And this is a diet that's high in fruits and vegetables and low in salt, more specifically limiting the salt intake to no more than 1 teaspoon in a whole day. To keep it simple for my patients, I also have them go by something called My Plate, which is actually an idea that replaced that whole confusing food pyramid that used to be out of many years ago. Basically, this is an idea in which you just picture a round plate, and half of that plate should actually be filled with fruits and vegetables on any given time when you have a meal. 1/4 of that plate can have some kind of lean protein there, as long as you limit how much salt you put on it, and the other quarter can have some kind of whole grains that aren't high in salt either. And if you stick to this, you should be able to eliminate your salt intake and also have a well-balanced and healthy meal. Another goal should be to eliminate what we call the salty 6. And this is basically a group of 6 foods identified by the American Heart Association as having some of the highest salt content out of all the foods that we commonly eat in the United States. And these include bread, pizza, sandwiches, cured meats and lunch meats, deli meats, soup, especially canned soup, and also burritos and tacos. 1 serving of each of those foods actually contains more than half of the amount of the daily allowance of salt that you're supposed to have in a day. So if you eliminate those alone, you're going to be getting off to a good start in terms of eliminating the salt from your diet. Now, the second way to beat hypertension is through exercise. Now, I'm not saying that you need to get up tomorrow and go run a marathon, but I'm just talking about at least getting 30 minutes of brisk activity in 5 days a week. And this can be either brisk walking or light jogging, anything that breaks you out into a sweat and gets that blood pumping. Now, I talk to my patients about exercise all the time, and they always say the same thing over and over again. Well, I do exercise. At work, I have to walk. I have to take X amount of steps per day, but that's not exercise. You still have to do some kind of dedicated aerobic activity outside of work every day. And this doesn't even have to be outside. It can still be indoors. Now, the third way to beat hypertension without medications is through weight loss. This is because obesity or being overweight can lead to you having a lot of fat in the central part of your body, and some of this fat can deposit into your arteries and cause them to become stiff, and that will end up raising your blood pressure. So slimming down is definitely an important key to controlling the blood pressure. The fourth way to beat hypertension without medications is through avoiding substance abuse, whether it be alcohol, cigarettes, or even stimulant use. In terms of alcohol, men should limit themselves to no more than 2 drinks of alcohol in a day, and women no more than 1 drink of alcohol in a day. And when I say a drink of alcohol, I'm talking about a 12-ounce can or bottle of beer, a standard glass of wine, or a shot of liquor. In terms of cigarette smoking, this is probably the most important modifiable risk factor when it comes to our overall health. We know that cigarette smoking can clamp down on the blood vessels and damage them as well, leading to all sorts of diseases related to the heart and the blood vessels in our body. Stimulant use is something that you might not necessarily think about right away when you talk about blood pressure, but the caffeine in stimulants, whether it be Monsters or Red Bulls or any of those other things that people use to give themselves a burst of energy, can actually raise your blood pressure temporarily. And then also you'll be surprised about how much sodium is in a can of Monster or a Red Bull or one of those other stimulants. That can raise your blood pressure too. So it's important to make sure you're cutting down on those and not overdoing it when it comes to those type of drinks. Number 5 is stress management. Everybody's exposed to at least some certain level of stress at some point in their life. However, some people are exposed to higher level of stress than others, and everybody's different in terms of how they respond to it. So because everybody's different, you're gonna have to find out what works best for you. But some ideas include meditation, relaxation or relaxing exercises, relaxing music, prayer, even getting one of those stress balls, because that can help relieve a lot of tension. And also, if there's certain people in your life that bring a lot of stress around you, you might need to rethink your associations. I'm just saying. And if all that fails, and there's always counseling at the end of the day too, so just going to your primary care doctor and asking them to refer you can be beneficial for a lot of people. Now, number 6 is a little bit more technical, but basically you need to actually rule out secondary causes of high blood pressure or hypertension. And these are basically different things that your body can be going through that's actually causing you to have high blood pressure. This includes kidney disease, sleep apnea, which is a condition where when you're sleeping, you literally stop breathing for a few seconds at a time throughout the course of the night. And there's also something called hyperaldosteronism, where you're making this hormone in your body that's causing you to hold on to more salt than usual, and that ends up raising your high blood pressure. There are also some unusual causes like thyroid disease, and also something called Pheochromocytoma, where you make another hormone that causes your body to just kind of rev up and increase your blood pressure as well. So every time you have high blood pressure, it's important to make sure you follow up with a doctor regularly so they can rule out some of these things and find out if there's some other reason why you have high blood pressure that's hard to deal with. And the lucky number 7th way to beat hypertension without medications is through regular monitoring, whether it be through doctor's office visits or blood pressure measurements outside of the office. Now, this is very important for a couple reasons. Number 1, you need to make sure that all this other stuff that we talked about is actually working. And number 2, you want to make sure you identify cases of either white coat hypertension or mass hypertension. White coat hypertension is where you're out in the real world, the regular world, just relaxing, and your blood pressure is actually normal. But then when you get to the doctor's office and you see a guy in a white coat, then all of a sudden you get nervous and your blood pressure shoots up. The opposite of that is mass hypertension, in which your blood pressure is high outside of the office, and then when you get to the office, all of a sudden it looks like it's normal. Both of these cases are things that are worth identifying, and they are both causes for concern. So all the way to really identify them is to regularly checking your blood pressure in both settings. So there you have it, guys. That's the lucky number, 7 ways to beat hypertension without medications. I hope you learned something. If you enjoyed the video, please give me a like and subscribe to Trust PCP for more breakdowns and other medical topics. In the future, I'm going to be releasing videos on the hypertension diet and also how to give up cigarette smoking. Thank you for watching. Peace out.